And boom, we're live. Don't go anywhere. Why you're not going to go anywhere is because somebody asked me a question and I have to answer it. So don't go anywhere. Let's go. Hey family, how y'all doing? Welcome to Questions and Answers with your CEO 3 times, the real Alisa Applewhite, which is I. Let's get to it, y'all. So this is again 15-minute lives Q&A with your CEO 3 times, Alisa. All right. So we do this every day at 12. So make sure you're going live at 12. And let's see what question we're going to answer. Boom, episode number 79. When can healthcare staff stop wearing masks? That's a good one. So let's get to it, y'all. All right, so I already put the timer on the clock. We got 14 minutes. I want to respect your time. So why do I go live Monday through Friday? It's because you keep asking me questions, right? So she gonna keep calling me. This is how kids are. When they are ready to do something, they just keep calling. And when you need them to do something, they don't answer. They send straight to voicemail. So I'm sorry, that was a little tidbit. My daughter keep calling me, so she messing up my Instagram family here. She look on my YouTube, she'll see I'm live right now. All right, so why do I keep going live Monday through Friday? Is because you keep asking me questions. So if you keep asking me questions, I'm going to keep answering them, right? Send them in my DM, email me, text me, call me, ask me questions about healthcare staffing, about business, about life, about kids, about being a wife, right? I want to help you to give you value in whatever question that you ask. So when you ask the question, I answer 3 things that I think can help you grow in your business, in your life, right? So we go live Monday through Friday. We go live Saturday. We go pre-recording Saturdays and Sundays. So every day at 12 o'clock for 15 minutes at minimum, you can always catch information on live on my channel so you can learn something. Right? It's not just healthcare staffing. It's really just questions people ask me and I answer. Like I did an episode. I remember when a guys kept asking me, why can't we be best friends? That was the funnest episode ever. It was just, it is so fun. All right. So this is another question that I get all the time. Why do they call me CEO 3 times? Y'all, it's very simple. I have 3 companies. Me and my husband have 3 companies, right? So company number 1 is top of the line healthcare staffing, where we staff medical professionals in hospitals, doctors' offices, and nursing homes. Company number 2 is TOTLHS, Heart of Gold Inc. That is our baby, our nonprofit, right? So we started a nonprofit because we have a Heart of Gold Gala for our medical professionals where we celebrate them. We literally just give them a spotlight. It's literally all about them. The whole night is about them, open bar all night. So we celebrating them and we are showing them our appreciation because most medical professionals just don't get the appreciation that they need. The Heart of Gold Inc. also helps our medical professionals with medical assistance. What is it? Bill pay assistance, mortgage assistance, rental assistance, car payment assistance, mortgage down payment assistance, credit education, financial literacy. wealth and generational building. So we do the holistic thing here with the nonprofit so we can take care of the holistic medical professional. All right, so then we have the Real Alisa Applewhite Consulting, which has brought you questions and answers live every 15, Q15 for 15 minutes. I'm thinking about the Q, y'all. I'm thinking about a medical order right now, right? So not only do we do lives, but we teach everyday people like you how to build a healthcare staffing agency from scratch to government. We also what else we do? We teach everyday medical professionals. I be talking to myself. We teach everyday medical professionals how to be the best medical professional they could potentially be. We partner with hospitals, doctors' offices to help them in nursing homes to help them to retain their staff. We also, the book. We have a book called Make the Call to Get the Client, where you can learn how to run a staffing agency from the book, but also learn the principles of just running a business in general, right? The principles are about the same. Then we do a podcast, Beyond the Scrubs podcast, where we take everyday people like you and medical professionals and we get their story out, right? So it's just different stories from patients and medical professionals so we can see what's going on in that healthcare world, y'all. Because if anybody in the healthcare world, they know that'd be like a whole soap opera by itself. So we just want to get the education out. We do a lot of education with us. We are starting a new venture, which I'm so excited about, where we will start teaching teenage kids about wealth building. It's crazy. Teenage and middle school kids about wealth building, right? So I'm just so excited about the company in general. Like, it's so much education in this company, right? So we want to see people succeed. We just truly do, right? My husband and I. All right, so let's get to it. So question number 79, when can healthcare staff stop wearing masks? All right, so I'm gonna give you 3 things. And I kind of researched this a little bit just to make sure that the dates and stuff were correct, because I want to make sure I'm giving you the right information that can help you in your business or talk to your charge nurse, whoever you want to talk to. All right, so when can healthcare staff stop wearing masks? The first thing I found out is that the mandate ended June 15th of 2021. That was not 2023. That is 2021. I'm typing really fast, apparently. Let's save it. Let's see. There we go. Federal. So there was a federal mandate where everybody had to wear a mask in the United States because of the COVID vaccine. The COVID virus. But the first stop for masks was if you were vaccinated, then you can stop wearing a mask. And that mandate was given in June of 15th of 2021. It was a federal mandate. But that was a federal mandate, just telling people in society, everyday people walking around, hey, you don't have to wear a mask anymore if you are vaccinated with COVID, right? So they did come up with a final date where nobody had to wear a mask if they was vaccinated or not. But this was the first official date when they said, hey, if you are vaccinated with the COVID vaccine, you do not have to wear a mask. So this only applied to the general public. This is not applied to the healthcare staff. And what people need to understand, in healthcare, there are some specialties that wear masks all day long. Like, this is, so it's not abnormal not to wear masks. There are some specialties that wear masks all day long. It's some, even in different specialties, if you get the right patient, if you get the right droplet patient, you have to wear a mask. Every time you go in that room, you have to suit up, right? Every time you go in that room, you get an Ebola patient, you have to suit up every time you go in the room. So this wasn't new for healthcare workers. I think what it was just wearing it everywhere, right? Wearing it everywhere, in and out of patients' rooms, different patients. And it was that you didn't give yourself time to breathe. I know for sure that when I was wearing the mask, like, I would have a sore right here. All of this was really sore and raw from wearing the mask. All of this like hurt. So when you go to wearing a mask anywhere from 60 to 72 hours a week, and it's consistent, and you could change out your first covering, your mask, which is a simple face mask, but when you got on that N95 or that duckbill or that respiratory the respirator mask, then excuse me, my eye was itching, or the respirator mask, then you got to go ahead and put it on. And some things about the respirator mask I thought was always cool is when you put it on, like the whole complete kit, it's like this cool air that kind of run through it a little bit, so it kind of gives you some breathing room. But then if you start to breathe the air, then that means the mask you got under that is not effectively working. I'm just saying. But but that's what I kind of liked about the respiratory mask. And then you had some full suit respiratory masks like the CDC normally wear, where you can breathe within the mask. But hospitals ain't giving that out. People had to order those themselves. All right, so the official mandate ended for the United States it was June 15, 2021. That was federal. So then CDC came around and said, all right, so the virus is calming down. They are considering COVID virus just like the common cold now, right? So people say, oh my God, it's COVID patients in this building. They are considering it just like the common cold. So healthcare, the CDC came out with a mandate that healthcare workers were no longer required to wear masks September 28th of 2022, right? So you're saying, Alisa, all right, if the CDC said healthcare staff workers do not have to wear masks in September of last year, why are they still wearing it this year? That is the question. And I'm going to answer that question on the next point, but let me go here. So the CDC determines, especially in healthcare settings, what we need to do, how we need to practice, what chemicals we need to use, how we need to target certain viruses that we come amongst, right? So the CDC pretty much has a template on this is how you deal with Ebola. This is how you deal with a TB patient, right? This is how you deal with a SARS patient. So when the CDC starts speaking for healthcare, it's like, oh, okay, all right, we got some backup that, because some of the CDC people are healthcare professionals and medical doctors, right? You got some that's not all medical professionals. People think the CDC is completely medical professionals. It's not. You got some consultants and stuff along the way, and you got some people with just regular degrees without a medical license. But in the CDC, they do have like Dr. Fauci, medical professional, right? So I don't even think Dr. Fauci. Yeah, he is CDC. Okay, so I had to think for a minute. But like you have some medical professionals and you have some that are non-medical professionals, right? But it doesn't mean they don't know what they're talking about. Everybody has an opinion, but then some things are facts and some things are opinions. You got to figure it out for yourself. But when the CDC speaks, hospitals, nursing homes and stuff normally listen because we want to stay with CDC recommendations. A lot of the certifications that hospitals get to keep their accreditation status, so like a hospital award or something like that, to be recognized as the number one hospital, the best hospital, right? They got to keep certain things called accreditations, which is certifications from like single areas or single organizations that say, boom, you're JCO certified or you're Joint Commission certified, right? To keep their status so people can come to them, because this is a world of choice now. People can Google who they want to be the doctor. They can Google the surgeries they had. They can Google the percentage of successful surgeries that a surgeon had. So it's such a big world, right? And in order to be competitive in it with so many healthcare facilities, you gotta be certified. You gotta get your numbers right. You gotta count, right? So that's why a lot of healthcare agencies and healthcare facilities, you'll see them going more to customer orientated and survey based, because that can determine how much funding they get into their building to keep operating and save people in those areas, right? And people got to understand that in certain areas, they have no access to healthcare. So that hospital, that small hospital that seemed like they got rotating staff and they never can keep nobody, that hospital wasn't there and somebody had a major incident like a heart attack or a stroke and they couldn't drive the hour and 15 minutes away or get the shipment, an hour and 15 minutes away. They need that access that's 15 to 20 minutes, something that's close to them, so they can get at least stabilized and sent to the next wet area. All right, so then I'm gonna because we got 2 minutes. When can healthcare staff start wearing masks? Y'all, it all boils down to this. When the facilities say they can, right? So even though the CDC said you don't have to wear masks, even though the federal government said you don't have to wear masks, as a healthcare staffing owner or a healthcare facility, if the CEO or the nursing director of nursing, anybody in that building that has power over the policies and procedures, they can say, hey, we want you to wear masks because of this, right? And they can come up with whatever rationale because it is their building, right? So the short answer to it is when the facility say they can. If the facility say you can stop, then you can stop. If the facility say you can't, you can't. Now we are coming up into respiratory season. Healthcare staff and owners pay attention to this. August starts the respiratory season. That's the little hint I'm giving right now for y'all. Okay, so we are coming into respiratory season where the patient you'll have more patients coming in because it's a respiratory season, which means you'll have to wear masks more because most of the patients come in with cough and sneezing. And then you don't know if they have TB, you don't know if they have the flu, right? You don't know what's going on with them. You just know that they're coughing and sneezing. So you're more likely to wear a mask to be more effective to protect not only you, but the patient as well. All right, so let's go over this. We got 46 seconds. Episode number 79, when can healthcare staff stop wearing masks? Mandate ended June 15th, 2021, federal level. Then the healthcare mandate ended with CDC September 28th for 2022. And guess what? When the facility said they can, it's just that simple. All right, y'all, I want to make sure that you are following me on all social media platforms. The Real Alisa Applewhite. Again, that is The Real Alisa Applewhite. Follow me on all social media platforms. I want you to go to my YouTube channel and like it now. Like it now. Stop playing. Stop playing. If you ain't my YouTube friend, you need to go be my YouTube friend. Next month is going to be a beautiful month, and I have a lot to give to my subscribers of my YouTube channel. So make sure that you are a subscriber, and the timer is out. So I'm going to go over 1 minute and I'll be done. All right. So make sure you are subscribing, y'all. Next month is going to be a very, 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 very powerful month. So it's only going to be through the people who are subscribers, right? I want to show appreciation for subscribing to my channel and watching my videos. I'm just so excited, right? All right, y'all. So I always end it with this. I absolutely love you. I'm so glad you came here to be with me today. Thank you. Thank you. I am glad you woke up. I am glad you're breathing. I am glad you chose to be here. I love you. And half of the people I do not know. Let me see who was this hand up here. All right, Mr. Applewhite, my biggest fan. My husband love him. All right, so you chose to be here, and I appreciate that. And I'm telling you that I don't know you, but I absolutely love you. But I promise you, I can't say this enough. The way that God loves you, there is not a human breathing, your mom, your husband, your kids, anybody, friends, that loves you the way God loves you. So what does this mean? It means if God has this much love for you, that's who you need to be building a relationship with. Not these human beings. You need to be building a relationship with God, and everything else will come, right? The relationships of the human beings will come, but build a relationship with God to know who you are. Like discover yourself, right? So definitely build a relationship with God. And if you are confused about who you are, what you need to do, guess what? I got a little secret. Build a relationship with God. I promise you, it has solved so many of your problems, right? All right, so that's going to be it. I absolutely love y'all. Stay tuned for episode number 80 starting tomorrow. Can't believe I've been live this many times, but I'm going to leave y'all. Which one I'm going to leave y'all with? I'm not doing the challenge. So let's do this one. Love you guys. Bye-bye. Healthcare is affected by everything, right? You could be walking and have a stroke, have a heart attack. Now you are in the healthcare system, right? You can just all of a sudden start having mental issues, and now you're in the healthcare system, right? You could be minding your business and somebody can come in and shoot you, or hit your car or something like that, and now you are in the healthcare arena. And this is why healthcare is so important to me, because to me it matters who's at the bedside, right? So I always say to people, it doesn't matter to me that I have a nurse that say, hey, I'm a nurse, or I'm a CNA, and they show up at the building, right? That doesn't show me their integrity. Their integrity, their accountability, their professionalism, it shows when the door is closed. That is how you know how true a person is to their mission of being a healthcare professional, right? Is how they treat the patients with the doors closed. And my goal is to help to educate healthcare staffing owners and also medical professionals, and again hospitals, on how to help medical professionals get back to that mindset of how to treat people when the door is closed.